Hi, I'm Candace from Topcon Healthcare University. MYAH captures non-invasive tear breakup time, one of the key diagnostic tests recommended by the DEWS report for the diagnosis of dry eye disease. Let's review the information the MYAH provides. Either select the TBT tab on the measurement screen or select your patient and the correct exam date from the home screen. Tap on TBT and double-click the exam thumbnail for the eye you want to review first. Select OD for right eye data and OS for left eye data. There are 4 tabs near the top of the screen: Summary, TBT, Maps, and Blink. The Summary tab is the default and displays metrics based on a combination of all selected tear breakup acquisitions, along with the Blink analysis data if this was also assessed on the same date. The map shows the corneal surface divided into sectors, with color coding to indicate the time in seconds after a blink for the tear film to break up. Hotter colors indicate a shorter average breakup time for that segment, with the time scale shown down the left side. The acquisitions included in the summary are displayed here on the right. You can choose which acquisitions to include by checking or unchecking the box for each thumbnail. The graph below the sector map plots the percentage of sectors where the tear film has broken over time. If tear breakup acquisition is repeated during a patient visit, each acquisition will be plotted on this graph in a different color. Here on the left, we see the average tear breakup statistics for all selected acquisitions. The top figure is the time taken for tear breakup to be detected over 5% of all segments. This is the most useful value clinically. The value below is the time to the very first break in the tears. Although, be aware that the tears can break and then reform, so this value tends to be more variable. The IBI, or interblink interval, is the average time between blinks captured during a blink acquisition. The ocular protection index, or OPI, is the ratio between the 5% breakup time and the interblink interval. For OPI values greater than 1, the patient blinks before the tears break up and the corneal surface is protected. For OPI values less than 1, the ocular surface is at risk of exposure because the tears break up before the blink. Be aware that a patient with dry eye disease may have an OPI greater than 1 if they blink very frequently. Now let's look at the other tabs available. The TBT tab is essentially the same as the Summary tab, except that the data on the left applies to a single acquisition. In addition, the duration of that particular measurement is stated. Select which acquisition you want to view by clicking on the thumbnail. The Maps tab allows you to play back a video of the selected acquisition with a choice of informative overlays. You can choose to examine the effect of tear breakup on the placido disc rings, the breakup sector grid, the topography map, or the anterior corneal aberration by selecting from the buttons at the top. Within this tab, you can select keratoscopy to view how the placido disc rings distort and break during tear film breakup. Selecting breaks allows you to review the tear breakup video as a color-coded sector grid. Selecting Maps allows you to examine how the corneal topography changes with tear breakup. The wavefront video shows the effect of tear film thinning and breakup on the aberrations of the anterior corneal surface. You can choose to review the whole optical path difference, or OPD, in other words, all higher-order aberrations of the anterior cornea and tear film, including astigmatism, or select from just astigmatism, spherical aberration, coma, or other higher-order aberrations. Going back to the tab options at the top, the Blink tab provides details of the blink assessment, including the average interblink interval, which is the average amount of time between blinks and the standard deviation of that value, and the number of blinks captured during that time, the total duration of the blink assessment acquisition, and the average number of blinks per minute. And that's an overview of the non-invasive tear breakup time and blink assessment captured by the MYAH. Thanks for watching. For more information, please visit Topcon Healthcare University.